Hey there, future nurses. You know, jumping into labor and delivery can feel like a whirlwind,
Mm.
especially as a first-year nursing student.
Yes.
So many new terms and procedures. And let's be honest, the stakes, they feel pretty high
Yeah.
when you're dealing with two lives at once.
Yeah, it's definitely a unique area of nursing, for sure, and one that really does require a special blend
Mm.
of knowledge, skill, and compassion. But we're here to break it all down,
Okay,
starting with a deep dive into pain management during labor.
perfect. Imagine this. You're about to support your very first laboring mom.
Oh, wow.
Maybe a little nervous.
Yeah.
Totally understandable. This deep dive is going to equip you with the essentials of pain management, giving you the confidence to provide amazing care.
And it's not just about memorizing, like techniques or medications. It's really about understanding the profound impact that pain has on the birthing experience
Right.
and how we can support women in making informed choices.
Okay, so let's unpack this, starting with why pain management is so crucial in labor and delivery.
Labor pain it's intense.
Yeah.
Unlike most other types of pain.
Hopefully.
It's a really a powerful physiological process, and every woman experiences it differently.
Yeah.
Some women describe it as cramping, others as intense pressure, and for some it's a combination of different sensations.
So it's not just about making the pain go away completely.
Right.
It's about helping each woman kind of manage it
Yeah.
in a way that works for her.
Exactly. And that's where having a variety of pain management options becomes so important, both pharmacological and
So
non-pharmacological.
speaking of non-pharmacological options, let's dive into those first.
Yeah.
What's in our natural pain relief toolkit?
So these techniques are often really empowering for women,
Uh,
especially in early labor.
Oh,
They can help manage those initial contractions and create a sense of control over the birthing process.
okay. So let's get specific. What are some techniques that I can actually picture myself using at the bedside?
One of the most basic yet effective techniques is focused breathing.
Okay.
And we're not just talking about taking like deep breaths here. Paced breathing, where you actually slow down the breath
Okay.
and really emphasize the exhale, can help regulate the nervous system and reduce anxiety during contractions.
So it's like hacking the body's stress response system.
Yeah.
I could see how that would be helpful when things get intense.
Exactly. Another technique is movement and positioning.
Okay.
Think about it. Have you ever had cramps
Oh, yeah.
and just instinctively shifted positions to try to find relief?
Absolutely. Sometimes just finding that sweet spot makes all the difference.
The same principle applies during labor. Changing positions, whether it's walking, rocking, or using a birthing ball, can relieve pressure on the pelvis, encourage baby's descent,
Okay.
and even improve blood flow to the uterus.
So we're encouraging moms to move and groove,
Yeah.
even during labor. Makes sense.
Right.
What about things like heat and cold therapy? I swear by a heating pad when I have cramps. Could that help during labor too?
Absolutely. Heat can help relax muscles and ease tension, while cold can actually numb pain signals. Applying a warm compress to the lower back or cold pack to the perineum can provide welcome relief for many women.
Right.
And of course, hydrotherapy.
Oh, yeah.
Like a warm bath or shower
Oh, yeah.
can be incredibly soothing and relaxing.
Ooh, I love the idea of bringing spa vibes into the delivery room.
Yeah.
I've also heard about massage and counterpressure being helpful.
Yes. Massage can ease muscle tension,
Okay.
promote relaxation, and counterpressure, where firm pressure is applied to the lower back, can be especially effective for back pain,
Okay.
which is really common during labor. This is where the partner or support person can really shine, providing those comforting touches and helping the mom cope with the intensity of contractions.
It sounds like creating a calm and supportive environment is just as important as the specific techniques themselves.
You're absolutely right. The environment plays a huge role in the overall birth experience.
Okay.
Things like dimming the lights,
Yeah.
playing calming music, and even using aromatherapy with essential oils can help create a sense of peace and relaxation.
So it's like a holistic approach,
Yeah,
addressing the physical, emotional, and even sensory aspects of labor.
exactly. We're aiming to support the mind-body connection during labor, recognizing that pain is a complex experience that's influenced by many factors.
Makes sense.
But let's be real, sometimes natural techniques just aren't enough.
Right.
That's where pharmacologic pain management comes in, right?
That's right. And it's important to approach these options with a balanced perspective. We need to understand the benefits and the potential risks of each medication to ensure safe and effective care.
So let's break it down. What are some of the most common pharmacologic options that we'll be dealing with
Hmm.
as labor and delivery nurses? One category is systemic analgesics,
Okay.
which are often opioids, given intravenously. These medications work by reducing the perception of pain, but they don't eliminate it completely.
So they take the edge off, but don't cause complete numbness. I'm thinking back to pharmacology class. Opioids can have some pretty serious side effects, right?
You're right. That's why careful monitoring is so important.
Right.
We need to be aware of the potential effects on both mom and baby.
Okay.
Opioids can cause drowsiness in the mother and may impact the baby's breathing after birth.
Okay, that makes sense. Continuous monitoring is key. Now let's talk about the epidural. It feels like the most well-known pain management option for labor, but I'll admit I'm still a little fuzzy on the specifics.
So an epidural involves injecting an anesthetic near the spinal nerves in the lower back. This blocks the pain signals from traveling to the brain, essentially numbing the lower half of the body.
Wow, so it's like temporarily switching off the pain pathway? That's incredible, but I imagine there are trade-offs.
Yes. While epidurals are incredibly effective at relieving pain, they can sometimes lengthen labor
Okay.
and might increase the chance of needing an assisted delivery, like forceps or a vacuum.
Why would that be? Does
Yeah.
the medication somehow slow down the labor process?
It's not the medication itself that slows labor. Epidurals can reduce mobility, which can affect the baby's descent and the effectiveness of contractions.
Right.
Also, there can be subtle effects on hormone release, which play a key role in the progression of labor. Additionally, there are potential side effects,
Okay.
like a drop in blood pressure
Right.
or headaches.
So it's a balancing act, weighing the benefits of pain relief against the potential risks. Sounds like peach education is crucial here.
Absolutely. We need to provide clear and unbiased information so women can make informed choices that align with their individual preferences.
Right.
It's not about, pushing one method over another. It's about presenting the facts and supporting their decisions.
Okay. I'm starting to get a feel for the complexity of pain management. It's not just about knowing the techniques, but also the nuances of when and how to use them. What about other types of regional anesthesia? I've heard of things like local and pudendal blocks. How do those fit into the picture?
Good question. Local infudendal blocks are used to numb specific areas, usually in the later stages of labor.
Okay.
A local block might be used for an episiotomy, for example.
So for those more focused procedures, that makes sense.
Exactly. A pudendal block targets nerves in the pelvic region, providing relief for pain during pushing and delivery. Then there's the spinal block, which is similar to an epidural but delivers the anesthetic directly into the spinal fluid.
So what's the key difference between a spinal block and an epidural? Why choose one over the other?
A spinal block provides very rapid pain relief and complete numbness below the waist, making it ideal for cesarean sections.
Okay.
However, it's shorter lasting than an epidural, so it's not typically used for labor pain management.
Okay, I'm starting to build a mental map of all these options. This is definitely helping to clear up some of the confusion I had. What about alternative and complementary approaches? I'm curious about things like acupuncture and TNS units.
Those are great options to consider. Acupuncture and acupressure involve stimulating specific points on the body to relieve pain and restore balance.
Okay.
Acupuncture uses thin needles, while acupressure uses finger pressure.
I've heard some women swear by these techniques, but how exactly do they work? Is it just like a distraction from the pain, or is there something more going on?
It's not just distraction. Acupuncture and acupressure are thought to stimulate the release of endorphins,
Okay.
the body's natural pain relievers.
Right.
They can also help relax muscles and improve blood flow.
That makes sense. So it's like tapping into the body's own healing mechanisms. I like that approach. What about TNS units? I know those use electrical stimulation, but I'm a little intimidated by the idea of electricity during labor.
Don't worry, it's not as intense as it sounds. TNS, which stands for transcutaneous electrical nerve stimulation, uses a small battery-powered device that delivers mild electrical impulses through electrodes placed on the skin.
Okay, so it's not like a jolt of electricity. It's more like gentle stimulation.
Exactly. These impulses help block pain signals and can be very effective, especially in early labor.
Okay.
And the great thing about these alternative and complementary methods is that they often have minimal side effects and can be easily integrated with other pain management techniques.
It's like building a personalized pain management plan based on the woman's preferences and needs.
Right.
And it's not just about the techniques themselves, right?
Right.
Our role as nurses goes beyond simply administering medications or applying 10 and S units.
Absolutely. We play a crucial role in assessment,
Hmm.
education, and continuous monitoring, ensuring the safety and well-being of both mom and baby.
Okay, let's dive deeper into that nursing role. I'm eager to understand what I can actually do at the bedside to make a difference.
It all starts with assessment. Before you can even consider pain management options,
Right.
you need a clear understanding of the patient's experience.
Okay.
And remember, pain is subjective. What one woman describes as a 5 on the pain scale might feel like an 8 to another.
So it's not just about asking what's your pain level on a scale of 1 to 10.
Yeah.
It's about really listening and observing to understand her individual experience.
Exactly. We need to consider the location,
Okay.
the quality, the timing, and any other factors that contribute to her pain experience.
Right.
We might use numeric rating scales, visual analog scales,
Yeah.
or even facial expression scales to help us understand her pain level.
It sounds like detective work. We're gathering clues, piecing together information, and using our knowledge to develop a plan of care.
That's a great way to think about it. And once we have a clear understanding of her pain,
Yeah.
it's time for education. We need to empower women to make informed choices about their pain management.
So this is where our communication skills really come into play.
Wow.
It's not about being the expert and dictating what she should do, but rather guiding her through the options and supporting her decisions.
Absolutely. We explain the different options in a way that's clear, concise, and unbiased. Discussing the benefits and risks of each, it's about respecting her autonomy and helping her make the best decision for herself and her baby.
And this education piece should start early, right?
Yeah.
Ideally, even before labor begins.
You're spot on. Prenatal classes are a fantastic opportunity for women to learn about pain management options
Nice.
and start thinking about what they might prefer. This can help reduce anxiety and make decision-making during labor a little bit easier. But even if a woman hasn't attended prenatal classes, it's never too late to provide education and support.
This is making me realize just how much responsibility we have as labor and delivery nurses. It's not just about the KICS skills, but also building that trusting relationship with the patient.
You've hit the nail on the head. Building trust is essential. And that includes being honest about potential complications. While we aim for positive birth experiences, it's important to acknowledge that things don't always go according to plan.
Okay, let's talk about that. It feels like the elephant in the room, what happens when complications arise. It can be scary to think about as a new nurse.
It's natural to feel that way.
Right.
But remember, complications can and do happen. Labor and delivery is a dynamic process.
Right.
And sometimes things take an unexpected turn.
So it's about being prepared both mentally and clinically for those curveballs that life throws our way. But how do we stay calm and collected when things get intense?
It comes down to your training
Yeah.
and critical thinking skills. You need to be able to recognize the signs of potential complications,
Right.
know the appropriate interventions, and act quickly and decisively to ensure the safety of both mom and baby.
It sounds like a high-pressure situation, but also incredibly rewarding to know you're making a real difference.
It definitely is. And just as importantly, you need to be able to provide emotional support and reassurance to the patient and her family during those stressful moments.
So it's not just about being clinically competent, but also being a source of strength and comfort for the patient and her family.
Exactly. It's about staying calm under pressure, communicating clearly, and working effectively as part of a team to navigate those challenging situations. And remember, even when things don't go as planned, there's still so much that we can do to support a positive experience.
I love that perspective. It's about focusing on what we can control, advocating for the patient's needs, and providing compassionate care every step of the way. I'm starting to see why so many nurses are drawn to labor and delivery. It's such a unique and powerful experience to be a part of.
It truly is. And as a new nurse entering this field, it's important to remember that you don't have to have all the answers right away.
That's reassuring. Sometimes it feels like we're expected to know Everything, straight out of nursing school.
Learning is a continuous journey,
Right.
and every patient encounter is an opportunity to grow and expand your knowledge and skills. Embrace those learning opportunities. Seek guidance from experienced nurses and mentors, and use those experiences to become even stronger clinicians. And remember, we're not superhuman. We can't prevent every complication. And sometimes, despite our best efforts,
Yeah.
things don't turn out the way we hope.
That's a good reminder. It's easy to get caught up in the pressure to be perfect. But it's important to be kind to ourselves and acknowledge that we're all learning and growing. But even in the face of challenges, there's so much beauty and resilience to be found in the labor and delivery experience.
Absolutely. It's a privilege to witness the strength of women, the power of the human spirit, and the miracle of new life.
It sounds like a roller coaster of emotions, challenging, rewarding, and awe-inspiring all at the same time.
You've captured it perfectly. It's demanding and challenging, but also filled with moments of joy, wonder, and profound connection. And that's what makes working in this field so incredibly special.
Well, I have to say, you've definitely painted a vivid picture of what it's like to be a labor and delivery nurse. I'm feeling inspired and a little less intimidated. What advice would you give to a brand new nurse stepping into this role for the first time?
Embrace the challenges, ask questions, never stop learning, and trust in your abilities. The world of labor and delivery is waiting for you, and I have a feeling you're going to do amazing things. Remember, you have a whole community of nurses, educators, and mentors who are here to support you every step of the way.
That's such a great reminder. We're not alone in this journey. We have each other, and that makes all the difference.
Another important skill is clear and concise communication. We need to be able to convey information accurately and efficiently, especially in urgent or high-pressure situations.
So it's about cutting through the jargon and getting straight to the point. No time for rambling in labor and delivery.
Exactly. We need to use clear language that everyone can understand, avoid medical jargon, and confirm that everyone is on the same page.
That makes sense. Miscommunication can have serious consequences in this setting. What other communication tips can you share?
Assertive communication is crucial, especially when advocating for your patient's needs. You need to be able to speak up confidently and respectfully, even when dealing with, more experienced healthcare providers.
So it's about finding that balance between being assertive and being respectful.
Exactly. And remember, you're not alone. You have a whole team of nurses, midwives, and physicians who are there to support you. Don't be afraid to ask for help or clarification if you need it.
This is making me realize that communication is much more than just talking and listening. It's about building relationships, advocating for our patients, and working together as a team to provide safe and effective care.
You've hit the nail on the head. It's about creating a culture of open communication and mutual respect.
Well, I have to say, this deep dive has been incredibly insightful. I'm feeling much more prepared to step into the world of labor and delivery.
And remember, as you embark on this journey, trust your instincts, ask questions, and never stop learning. You have the potential to make a profound difference in the lives of women and their families.
That's such an inspiring message. I'm feeling excited and ready to embrace the challenges ahead. What about you, listeners? Are you feeling the same way?
Remember, you're not alone. You have a whole community of nurses, educators, and mentors who are there to support you every step of the way.
Well, on that note, I think it's time to wrap up this deep dive.
It's been a pleasure sharing our insights with you.
Thank you so much for joining us today. We hope you found this deep dive helpful and inspiring as you embark on your journey as labor and delivery nurses. Remember to embrace the challenges, ask questions, and never stop learning.
And most importantly, remember the privilege it is to be a part of such a special and transformative experience in the lives of women and their families.
Until next time, stay curious, stay compassionate, and keep those nursing brains firing.